Hello, I'm Dr. Kyle Bonesteel, Director of Neurohealth Associates, and I really appreciate the opportunity today to talk with you about some very exciting developments in the areas of brain mapping and neurofeedback, and also to invite you to learn more about what we do here at Neurohealth Associates. In this day and age, there really is no shortage of symptoms and challenges that we all may face at some point in our daily lives, whether it be having a child that has a learning disability or symptoms of ADD, who's trying to do better in the classroom, or an adult who may have symptoms of anxiety or insomnia, who simply wants to get a better night's sleep and feel more peace of mind during the day, or a busy professional who's experiencing the symptoms of burnout, who wants to improve his or her workplace performance and cognitive efficiency. In all of these scenarios, the goal of treatment is still the same: improved brainwave activity, improved brain regulation, and ultimately a higher quality of life. One of the most popular forms of treatment that we utilize here at Neurohealth Associates is called neurofeedback. And neurofeedback has been reported to be an effective form of intervention for symptoms of ADD, ADHD, learning disabilities, anxiety, depression, post-traumatic stress, traumatic brain injury, chronic pain, and perhaps even some forms of mild autism. Neurofeedback is also increasingly being used in the areas of peak performance to help athletes, executives, and students perform better. The goal of neurofeedback treatment is to teach the brain and reinforce it for the production of good and balanced brainwave activity. When our brains produce good brainwaves, it's easier to focus and to concentrate, relax, and to maintain a steady mood. And when our brains are engaged in a good timing pattern, the brain is more able to integrate complex information, allowing us to plan, sequence, organize, comprehend what we read, and hold more information in our short-term memory bank. All of the functions that our brain serves for us that we simply take for granted on a day-to-day basis. This is how neurofeedback works. You see that we have sensors placed in designated locations on the person's head in areas of the brain that we know aren't producing good enough brainwave patterns. Those sensors are attached to a computerized monitoring system that is analyzing those activities in terms of mathematical statistics. And it's being graphed out on this computer screen here. So this technology detects positive shifts in brainwave activity and not so good shifts in brainwave activity. Whenever a positive shift in brainwave activity occurs, this technology interfaces and communicates with this video and converts that into increased speed of the spacecraft. So better brainwave activity gets detected, and that information converts into increased speed of the spacecraft. Here's an example of a really good brainwave pattern. It's nice and quiet across the different frequencies, and it has good balance. Okay? When this happens, the spacecraft on the computer screen will go faster. And where we see red, that means that there's a not so good pattern being produced. And when that happens, the spacecraft on the computer screen starts to slow down, as you see here. So everything that's going on the computer screen is a direct reflection of what's going on in the person's brain. And what we have here is an informational feedback loop. So over and over and over again, we are reinforcing the brain for producing healthier, more balanced brainwave patterns, and we're not reinforcing it for producing the type of patterns that are likely to contribute to a person's symptoms. And that's how the brain learns, through guidance, reinforcement, and more reinforcement. The brain map is a very advanced form of evaluation that helps us understand where in the brain the problem is in terms of brainwave imbalance and a lack of good timing patterns. We take this information and tailor the person's treatment approach accordingly. Once the brain map is performed, we then conduct statistical analyses and produce color-coded maps for that person's brain. In a snapshot, we can see where the problems are and in what frequencies. Problems with depression or anxiety are often associated with imbalance in the temporal lobes here on the sides. Symptoms of anxiety and ADD are often associated with imbalance toward the front and the central part of the brain here. Results tend to last, although a subset of patients require booster sessions for best results. Neurofeedback is intended to teach the brain to regulate itself and consequently is not dependent on lifelong therapy for ongoing effect. However, neurofeedback should be consistent because we have to reinforce the brain for producing good brainwave patterns over a period of time. Success rates vary from 65 to 85% depending on the definition of success that is used. When we exercise or learn how to ride a bike, our bodies develop what is called muscle memory, which allows our bodies to remember how to perform complex tasks automatically. Neurofeedback is a lot like developing muscle memory, but it's more for the brain rather than the body. So once we learn how to do neurofeedback or learn how to ride a bike, eventually it becomes automatic and second nature for the brain to do this on its own. Usually the answer is yes. Neurofeedback and cognitive therapy do not conflict with medication, although we tend to handle this on a case-by-case basis in conjunction and consultation with your prescribing doctor. The side effect profile for neurofeedback has been historically very low and time limited. Although side effects are very uncommon, there is the slight possibility of feeling a little more fatigued or a little more over-energized after a treatment session. And this is an indication to us that we need to make a modification to the treatment protocol. Please feel free to contact our office directly with regard to these types of questions. Neurohealth Associates is dedicated to providing you the most advanced forms of treatment technology at the lowest possible cost. And in fact, neurocognitive testing and cognitive and behavioral therapies are often covered by many insurance companies. But again, feel free to contact our office directly and we'd be happy to work with you with regard to your insurance questions and issues. Neurofeedback has not been as widely known for a variety of different reasons. First of all, it's a non-medicinal, non-invasive form of treatment born out of the areas of neuroscience and psychology rather than the field of medicine. Consequently, your general physician or pediatrician may not know a whole lot about neurofeedback, although most have at least heard of it by now. Second, behavior therapies and medication have historically had the most controlled published research findings, although neurofeedback, to its credit, has an increasing number of studies done and more is being conducted every year. I'm Dr. Kyle Bonesteel, Director of Neurohealth. Thank you for taking the time today to learn about this very exciting area of treatment and how this approach may be helpful for you or someone that you love. Please feel free to contact our office if you have any further questions. Thank you.
The doctors of Neurohealth Associates are extensively trained in clinical psychology, neuropsychology, behavioral neurology, and various forms of biofeedback and neurofeedback. Collectively, they have, or currently, belong to the American Psychological Association, the National Academy of Neuropsychology, the International Neuropsychological Society, the American Academy of Neurology, the International Society for Neuronal Regulation, and the EEG and Clinical Neurosciences Society. Our director is a fellowship-trained neuropsychologist and assistant professor of neurology at Loyola University Medical Center.